Hi, good afternoon. I'm Edwin Carrascal. I'm going to report now the anatomical movements, especially for my topic, pronation and the supination. I would like to share my screen for my report. Anatomical movements can be defined as the act of instance of moving the bodily structures or as the change of position in one or more of the joints of the body. Joint actions are described in relation to the anatomical position, which is the universal starting position for describing movements. Types of anatomical movements: flexion and extension, abduction and adduction, medial and lateral rotation, elevation and depression, pronation and supination, dorsiflexion and plantar flexion, inversion and eversion, opposition and deposition, protraction and retraction. But we are going to tackle only for my topic that is pronation and supination. Pronation and supination, as you can see on the photo, it is the movements that define the orientation of the palm, forearm, or foot in space. Pronation and supination are important movements that help us do various daily activities. Movements that occur that the proximal radio-ulnar joints, the head of the radius is discoid and fits with the radial neck within the circular and annular ligaments that attaches the proximal radius to the ulna. That is that we can see on the photo. There's a ulna and radius pronator quadratus. So the radius is always rotating or twist for the ulna bone. Okay. Pronation. Pronation is internal rotary movement of radius on ulna that results in hand moving from palm up to palm down position. Supination. External rotary movements of radius on ulna that results in hand moving from palm down to palm up position. This is the main different of the pronation and the supination. The pronation is the internal rotary movements from palm up to palm down position, and the supination is the external rotary movements from palm up to from palm down to palm up position. Okay, pronation and supination for foot. Supination and pronation in the foot are terms used to describe the mechanics of how you stand, walk, and run. Ideally, your weight should be balanced on your feet as you move. Your feet should not lean in, that's pronation, or lean out, that is supination. Supination means that when you walk, your weight tends to be more on the inside of your foot, but the supination means that when you walk, your weight tends to be more on the outside of your foot. So that's the difference of the supination and pronation regarding for the foot. So pronation means your weight tends to be more on the inside of your foot, and the supination is your weight tends to be more on the outside of your foot, as you can see on the pictures. Excess supination. If you have excess supination, it causes stress on the outer side of your foot when you walk or run. Your shoe will shoe and even wear on the outside part of the sole. If you're supinate, it can cause excess strain on your ankles. It may lead to shin splints, calluses, or bunions on the outer side of your foot and pain in your heels and balls of your feet. Excess supination is also called underpronation. So excess supination is other term is underpronation. Excess pronation. Excess pronation or overpronation means that as you walk, your foot rolls towards the inside and your arc toward tends to flatten out. Your shoe will shoe and even wear on the inside of part of the sole. Overpronation is more common than underpronation. If you over overpronate, you may develop pain in your arc, heel, ankle, shin, knee, hip, or back. Causes: it's likely that you were born with feet that tend to overpronate or underpronate. This may be because your arc is too high or your leg lengths are not even. but it can also result from injury, overuse, or walking or standing on hard surfaces. Overpronation may also result from obesity or pregnancy. Possible injuries: if you're a runner, power walker, or athlete, and your pronation is not neutral, it is a good idea to see a professional for acute assessment and treatment. Orthotics or special shoe may help you avoid ankle sprains, heel spurs, plantar fasciitis, metatarsalgia, tendinitis. Your doctor, trainer, or physical therapist can also suggest stretches and exercises to help you walk and run properly. The forearm. The forearm is the lower half of your arm from your elbow joint to your hand. It's composed of two long bones, the ulna and radius. The ulna remains stable while the radius rotates to supinate or pronate your hand. When your palm and forearm are facing up, they are supinated. When they are facing down, they are pronated. Injuries. The forearm is a common location for injuries in falls, crashes, and sports. Forearms injuries are especially common among children. Forearm breaks in one or both bones account for most limb fractures. Forearm injuries are common in sports, especially racket or throwing sports. Overuse and other injuries of the forearm that affects the nerves in the elbow or wrist mimic in it pinfall or pronate or supinate your arm. Forearm and wrist injuries may also come from overuse in playing a musical instrument, sewing, or other repetitive work with arms and hands. Both radial tunnel syndrome and pronator syndrome are common injuries of forearms. Overuse in sports that involve excessive flexion or your wrist or pronation supination movements. Pronator pronator syndrome is caused when the muscles in your forearm compress the median nerve in your arm. It causes pain and numbness in your arm that may extend to your palm. It may painful to make the OK sign. Radial tunnel syndrome is caused by entrapment of the radial nerve. The wrist. Your wrist, your wrist is an extension of your forearm. It can't supinate or pronate on its own. Supination and pronation of the arm come from arm movement, not wrist movement. Specific wrist movements include flexion, extension, and side-to-side movement of the hand. Wrist injuries related to sports are common. About 25% trusted sources of all sports-related injuries involve the wrist or hand. Wrist injuries that may affect arm movements includes carpal tunnel syndrome, which comes from pressure on the median nerve in the wrist. Treatment for foot. Excess pronation or excess supination in the foot is well studied in sports medicine. It can cause an imbalance in your body alignment that leads to pain in your feet, legs, knees, hips, and back. Treatment is usually conservative, and it will depend on the severity of the problem. The aim will be to correct the imbalance and help you avoid injuries. A foot professional can analyze your gait and the extent of your excess pronation or supination, maybe suggest orthotic and so as to correct your misalignment or heel lift of your foot. If your legs are different lengths, in some cases you may need special footwear or splints. The right shoes. Wearing well-fitting supportive shoes is important. People with excess supination or pronation need shoes with proper cushioning and plenty of two room. Fortunately, today there are plenty of sports shoe choices. People who have excess supination need cushioning, flexibility, and support in the health of balance, the outward roll of the foot. Those with excess pronation need a more stable shoe with a firm midsole and heel cushioning. Look for a good shoe store with an experienced fitter to help you, or bring your new shoes to a podiatrist or physical therapist to check them out before you start wearing them. Treatment for forearms and wrist. The first line of treatment for forearm and wrist injuries is conservative. Protect or stabilize the area with a brace of splint, especially at night. Modify your activities. Rest. Ice the area. elevate your arm, use non-steroidal anti-inflammatory drugs to help with pain and inflammation, work with a physical therapist or stretches and strengthening exercises. A health professional, a health professional may use an instrument called a goniometer to measure your arm range of motion, including supination and pronation. Before and after treatment and physical therapy, the goal is for you to regain full range of motion. Summary of my report is that supination and pronation are terms used to describe up or down orientation of your hand, forearm, or foot. If your feet are supinated or pronated, proni- pronated in excess, it can throw your body's alignment off and make you prone to injury. It is important to see a doctor and get treatment that can help correct your instance. For athletes or people who play sports involving rackets or throwing, overuse can cause problems with supination and pronation of your arms. Overuse may also. Thank you, and God bless all. That's all for my report for the pronation and supination regarding for the anatomical movements. Thank you, everyone, and God bless.